Coronavirus has devastated the global economy and killed more than 270,000 people as it spread exponentially. As conversations shift towards reopening the country and getting people back to work, proper sanitation in high traffic and public spaces will be key to getting back to normal. In places like China, robots and drones are being used to spray disinfectant in public spaces. Airlines and companies like Amazon have been using fogging as a sanitation technique to keep their facilities clean. But there is another option. UV light is an effective disinfectant that has been used for decades in hospitals and operating rooms. Though powerful UV light cannot be used on the human body, it can help prevent the spread of the virus. And technological breakthroughs could see UV light become a key piece in returning to normal in a world with a looming COVID-19 threat. Ultraviolet light was discovered more than 200 years ago. It was first used for disinfecting surfaces in 1877, for water in 1910, and for air in 1935.
UVC has been known for more than 100 years now to be really, really good at killing microbes, bacteria and viruses both.
Ultraviolet light is part of the electromagnetic spectrum, which includes things like gamma rays, X-rays, infrared light, microwaves, visible light, and radio waves. Ultraviolet light is grouped into 3 categories based on the light's wavelength. There's ultraviolet A, ultraviolet B, and ultraviolet C. The sun produces all 3 types of UV radiation, but we only experience A and B on Earth's surface. Within the spectrum of ultraviolet light, UVC, which sits at 200 to 280 nanometers, is in the germicidal disinfecting range.
We know that ultraviolet light is effective against many different kinds of viruses, many types of bacteria, and even some very hardy bacteria that can produce spores with thick coatings on them. Ultraviolet light can be effective against those and effective against fungus also.
UVC light interferes with and destroys the nucleic acids, the DNA or RNA of bacteria, viruses, and other microbes.
What it does is it causes chemical bonds that aren't supposed to be there to form within the genes of the microbe. And those new chemical bonds prevent the microbe from replicating. And because the microbe can't replicate any longer, it effectively kills it off.
It breaks open the protein shell of a pathogen. So imagine a pathogen, and everybody's seen a cell under a microscope. Imagine it like an egg, and you're cracking an egg. And once you've cracked the egg, you can't put the egg back together. That's what we're doing on a microscopic level.
Ultraviolet light can kill microbes in many different environments. It has been used for several decades to disinfect drinking water, wastewater, air, pharmaceutical products, and surfaces against a whole suite of human pathogens. UVC light has been used to combat other coronaviruses such as MERS and Sars, and it was used against Ebola. It's been proven effective and is expected to also work against SARS-CoV-2, the virus that causes COVID-19.
Because we know it's effective against the coronavirus family, and there's structural similarities between all of the viruses in the coronavirus family, everybody expects that ultraviolet C light will be very effective against the SARS-CoV-2 virus.
UVC light has been increasingly used in healthcare environments to prevent infections in hospitals.
As we started to see more drug-resistant bacteria and drug-resistant fungus, there's really a growing interest in the use of ultraviolet C light to help disinfect our healthcare environments.
UV light is efficient as a disinfecting tool, and it just needs electricity to work.
As long as they have the robot and a box of bulbs, they can take energy, electricity, and convert it into disinfection.
It's faster and less labor-intensive than cleaning by hand. It also reduces the need to clean with powerful chemicals. Ultraviolet light could be a powerful tool in the fight against COVID-19, and in some instances it's already being used. China is disinfecting entire buses with UV light, and banks are using UVC on currency. The Pittsburgh International Airport became the first airport in the U.S. to deploy autonomous cleaning robots equipped with ultraviolet lights for disinfection. Daimler has a device designed specifically to disinfect planes called the Germ Falcon. It's the size of a drink cart and has articulating arms that extend over the planes. Dimer claims it can kill 99% of germs in 3 minutes, and that it takes 30 to 45 minutes to clean an entire wide-body airplane.
We're primarily focused on viruses, like influenza, norovirus, Ebola, and right now we're dealing with coronavirus.
But one of the biggest challenges we face is how to keep public, high-traffic areas clean.
As we get back to work in the next few months, and we'll be in rooms and much closer to each other than we were before, there's the concern again about transmission of viruses from one person to another.
There is, however, promising potential for a new breakthrough in ultraviolet tech that could help. Researchers are experimenting with a shorter wavelength type of UVC, which could be safe for human exposure, but still effective against microbes.
What we've been working on is a type of UVC light which not only will kill viruses, but is safe for human exposure.
This technology was initially developed to help mitigate the spread of influenza, but it's expected to be effective against SARS-CoV-2. Far UVC lights are in the process of being tested on mice, and initial safety results are promising. Far UVC lights could be permanent fixtures in public places like offices and airports to prevent the spread of viruses and other microbes.
We've seen a huge amount of interest from places like hotels, from gymnasiums, from schools, from office buildings. People have wanted to disinfect ambulances. We've seen a lot of interest from airports and airlines. And then not to mention old age homes, nursing homes, skilled nursing facilities. COVID has really brought the importance of disinfection home to almost everybody all over the world.